In the 1950s, phencyclidine or PCP was developed as an IV general anaesthetic. Now, it was very successful in knocking patients out for surgery, but when they woke up, they were agitated, delusional, and irrational. So scientists tried to refine PCP, and as a result, they developed ketamine. Ketamine also was a very good general anaesthetic, but there were some bonuses. It didn't affect the cardiovascular system and the respiratory system like other general anaesthetics, so no drop in respiratory or respiratory depression, and their blood pressure wouldn't drop. But a weird side effect was when patients came out of the anaesthesia, they were dissociated or detached from the outside world. Now, ketamine was used quite widely in the Vietnam War as both an anaesthetic agent but also a pain medication in major battlefield trauma. Now, the proposed mechanism of how ketamine works is that we know that nerve cells or neurons speak to one another with neurotransmitters. So they release a neurotransmitter across a cleft and bind to a receptor and then activate another neuron. So in this context, we're talking about the neurotransmitter glutamate. Glutamate would be released from this neuron and bind to an NMDA receptor on this neuron, activating it. So ketamine actually blocks these receptors, and then this becomes very useful as a general anaesthetic, but also a pain medication in smaller doses, particularly chronic and neuropathic pain. But scientists were interested about the dissociated effects of ketamine, and so they applied it in a particular schizophrenic model, and they found that these patients that were given ketamine had an improvement in mood. So today, ketamine's not only used as a general anaesthetic, particularly in pediatrics, but also in chronic pain states, in palliative care, but also in psychiatry, in treatment-resistant depression, and also major depressive disorders.